Good afternoon, everyone. Thank you for joining today's Field Force Monitoring in the COVID Era webinar. Please note that all lines have been placed on mute to prevent any background noise. If you would like to ask a question, you may do so via the Q&A feature in your GoToWebinar dashboard, or you may use the Raise Your Hand feature to ask your question via telephone. We will have a few polling questions throughout the presentation. The results of those polls will also be made available after the call has concluded. Once our speakers have concluded, we will compile the Q&A roster. Please also note that the call is being recorded and all materials will be made available and sent out as soon as possible. I will now turn the call over to Saul Hellman. Go ahead, Saul.
Hi, everyone. As we face at least another month, if not more, of social distancing, we thought it would be useful to share some collective thoughts that we've talked about, but also heard from our clients around our industry's approach to field force monitoring. I know many of you, Saul Hellman. I'm a global partner in our life sciences practice, and I spend a lot of my professional time spending time with boards, compliance committees, and chief compliance officers advising on compliance advisory needs. I'm going to hand over to Mark Farrar, who will introduce himself and take it from there. Looking forward to the discussion.
Thanks, Saul. Hi, my name is Mark Farrar, and I'm a partner and the global practice leader of our life sciences governance, risk management, and compliance practice, and based in Atlanta, Georgia. I've been with Guidehouse for 12 years, but in the industry for over 20 years. I'll stop there and turn it over to my colleague, Awet.
Thank you, Mark. Hello, everyone. I'm Awet Geber-Hewitt-Wilder, an associate director in our life sciences practice based out of our Los Angeles office. I've been with Guidehouse for the last 5 years, and I primarily lead our field force monitoring service line for CIA-related or proactive monitoring. And previous to that, I carried the bag for about 12 years. So welcome. Thank you for joining us. I'll turn it back to Mark.
Perfect. And if we could move to the next slide, we'll kick off here. So as Rebecca had said at the very beginning, today we're talking about field force monitoring and the evolution of moving from traditional field force monitoring to more virtual field force monitoring, and how's that accomplished. And we've put a couple of the different types of what I would consider a traditional field force monitoring, looking at ride-alongs, reviewing coaching call notes and field coaching reports, sampling and lunch and learns and speaker programs, all those things that are listed here. And this is really where I think the rubber meets the road. Both of these are promotional and non-promotional, but your organizations might not actually conduct all these different types of monitoring activities, which is okay, because at the end of the day, you need to do what's right-sized for your organization. But in this new era in COVID, how can you go about making sure that you continue to monitor these types of activities, and how you're going to go about doing that? And that's a lot what we're going to discuss today, and some of the best practices. We'll share some of the polling questions, because this is something that we're all experiencing together live. None of us have ever done this before in this era. So we wanted to get together as a group and share best practices, and we'll compile those results and send them out. And hopefully you can take what you've learned here and what we can share and build your virtual monitoring program. So I'll turn it over to Saul to go to the next slide.
So as we think about how we approach healthcare professionals in the market, we thought that these few key concepts or a framework are useful to keep in mind. They're not exclusive to our situation right now in the context of virtual engagement, but we felt that they were worthwhile highlighting. They're very much appropriate in a normal scenario as well. I think one of the most important ones is respect. As we've spoken to many of our provider clients, we've identified that healthcare professionals, number one, are incredibly busy right now, not only with managing any potential COVID cases, but just busy trying to figure out the best way to run the healthcare system as we go through this. So respecting their professional role in society, and also respecting their daily responsibilities, which are probably not normal either. We feel is a very important thing for our industry to recognize, but also our sales reps and our medical liaisons and access coordinators in the field. Obviously, using materials should be approved or pre-approved through an LMR type process, unaltered and on-label materials being used in communication. This becomes a challenge, obviously, when we move to the electronic format, start to leverage things like email, WhatsApp, and platforms like the one that we're using right now. And certainly may fly in the face of some of the policies that companies have in place as it relates to usage of those platforms and technologies. Communications, another really important part of the framework, being clear to the audience, to the healthcare professional on the other side of the vehicle that's being used, who you are, which company you represent, and what your role is in the company. Whether you're serving a role in a commercial or promotional setting, or serving a role in a medical or scientific setting. Social responsibilities in terms of encouraging and fostering participation in charitable donations. And then finally, data privacy, understanding what's permitted in terms of recording of conversations and obtaining appropriate consent before any personal information is captured in call notes. So hopefully that framework will help frame some of this discussion, but also your internal discussions as you look to how sales reps go forward from a business point of view, and how you as compliance professionals seek to monitor and confirm that the organization continues to be in line with promotional expectations and or scientific exchange expectations. So with that framework in mind, I'll hand off to Awet, who will take us through the next few considerations and slides.
So that brings us to field force monitoring and what's next. As you know, most of your organizations are still trying to integrate what you've done in the past with now what that looks like in the future. Your HCPs, your field force teams, and other business partners will not have time for uncertainty or for any approaches that you decide to take. You want to make sure they're not going to be easily misunderstood. As we're moving interactions now into the virtual environment, that will increase complexity. So you want to make sure that your teams are prepared and that you have all the necessary controls in place to continue your monitoring efforts moving forward. I think, Mark, this would be a good time maybe for a poll-off question.
Sure. So let's give our first polling question here. And the question is that as an organization moving forward, are you conducting speaker programs? And as you can see here, we'll give everyone 30 seconds or so to give an answer. But there's a lot of things that for consideration here. I would encourage everyone as well that's listening to use the raise your hand feature. And if you have additional questions or want to provide additional context, please do so. As we mentioned at the very beginning, we'll collate all those responses and commentary and provide it back, as well as the results to the poll here once we send out the slide deck at the conclusion of this event. But as you can see here, the question just being, are you still conducting these? Have you suspended all live programs? Are you scaling back and moving to virtual? Have you just canceled all programs until further notice? So we would appreciate your input. And maybe what we can do now is move to the second polling question, which is really the same question, but looking at are you still considering providing advisory boards during this period of time? And there's a whole new set of challenges with advisory boards, because it's not just a listen only. And you know, as you're looking through and considering from your organization of how do you determine active participation in advisory boards? Is it you have to have those HCPs that you're engaging have webcams? And you know, even considerations are you adjusting any amounts that are being paid to them? And how do you deal with time zone issues? So there's a lot of different considerations if you are deciding to move forward with advisory boards. So with that, hopefully you've had a chance to answer, and we can move to our next slide. I'll turn it back over to Awet, who will cover some key considerations with virtual activities.
Thank you, Mark. So as organizations, you're still integrating your traditional monitoring activities into your compliance program. However, due to new standards and now limited access, some of these typical field force engagements or monitoring activities that you would need to do live, you may want to expand the other areas where access is not impacted, such as records review. When you're thinking about your field rides and ways that you can still monitor, e-detailing comes to mind. A couple of things you want to consider, though, is selecting platforms that have easy access for HCP use. There's multiple programs and platforms, so you want to make sure that that's not going to be a deterrent for HCPs to actually engage with your field force team. You also want to consider materials. You want to make sure that they're pre-approved and uneditable, that they can be presented and distributed in an electronic format. If possible, you also want to make sure that you can limit verbal-only presentations and then try to encourage presentations that also are accompanied by approved materials. This way you reinforce approved messaging and you ensure, or you at least assist your field in not having unsubstantiated conversation. You also want to make sure that they're balanced with safety information, that the information is still the information that they're providing in a live in-person setting, and that they're not taking any shortcuts because now they're doing it in a different format. If you can utilize any programs that allow for tracking and attestation of materials provided, that's also a beneficial use to your compliance program as far as monitoring. And then again, some of the other areas such as speaker programs where you can utilize virtual WebEx is still an opportunity for you to monitor the interactions between the field and HCP. We can also talk about later on records review, again, other areas where you will not impact access to HCPs, but you can still fulfill your monitoring engagement. Mark, would you like to ask another polling question? I think would be good around this time.
Sure. So the next polling question, and hopefully everyone was able to answer the first two. I saw it was stuck a little bit there for a moment. I think everyone around the globe is using these technologies, and sometimes makes it go a little slower. But our third polling question here is how do you achieve fair balance when you're e-detailing? I know that's always an issue when we're out in the field monitoring and making sure that the messages that are being delivered strike that right balance of making sure to provide those HCPs with the benefits of your product, but also making sure that they're aware of the risks associated with them. And how do you go about doing that? With e-detailing, do you do it verbally? And how do you track that? Or would you email a PI after every call that you have? Or if you're using a technology platform such as GoToMeeting and you have a PI displayed during the entire conversation, is that good enough? So these are questions I think that a lot of people are trying to figure out as they move forward into this virtual detailing and how to accomplish that fair balance. So let's move to the next slide, and I'll turn this back over to Awet.
Okay. So in talking about field force monitoring, really expanding your post-monitoring activities, again, where access won't be an issue. Some areas to look into are MIR, or medical information requests. Getting a chance to review medical information requests, especially for areas where potential off-label usage is extremely high. You want to identify any trends or increases among products, disease states, territory, or even granular sales representatives where an increase in MIRs above the threshold or recommended threshold have been seen. When looking at call notes, you really want to take a look at formal and informal discussions, best practices, team meetings, informal communication among sales reps, or even directional from their managers. With electronic communication, obviously you'd like to use a platform that's amenable to review. I would reassess your search terms, maybe look for new phrases and words that may have increased now due to the change in how they discuss their products with HCPs. You also want to identify and expand metrics that include a higher percentage of the field force you're currently monitoring. So if you're doing a smaller percentage, you might want to increase the breadth so that you can see if there's any changes or trends across the country or if it's district specific. In looking at sample distribution, I know access is going to be hard. Some of these may be drop shift, but if you are seeing any significant increases in sampling, again, above the recommended threshold, you'll want to pay attention to that, as well as develop some updated practices as required for sampling, again, with limited access to HCPs. Another area would be verbatim records. Usually you can get an idea of maybe messages that are being disseminated to HCPs and their understanding of some of these messages, especially if you have a product launch or a label update. You want to make sure that that information isn't lost in translation or there's unsubstantiated information flowing. The other area is reviewing, again, field coaching reports, because around this time, management will be giving directions, and again, you want to make sure that's in line with legal and regulatory and how information is not going to be disseminated to your HCP. Saul, I'll turn it over to you.
Great, thanks, Awed. So while companies are transitioning to more of a digital approach as it relates to field interactions, working with your brand teams, your sales ops coordinators, and the marketing teams, working with them to create messages that are more relevant and perhaps targeted is going to be important and instrumental in not only providing current substantial information, but maximizing the limited time that healthcare professionals have as their caseload or complexity of their operations increases. Using the various technology platforms will allow for a company to still engage in previously conducted activities, but both from a promotional standpoint, but also from a compliance perspective. And as Awed just covered, a number of those potentials around monitoring will help enforce that and continue to maintain an effective compliance program from a detect, correct, and most importantly, prevent perspective. Healthcare professionals certainly understand that there's still a need for the sales representative and the sales rep interactions, and the relationship is mutually beneficial in the context of, certainly from a healthcare professional's point of view, learning and understanding the use of your products. Healthcare professionals are provided with up-to-date clinical data, patient resources, samples, access to other aspects of what a company might be providing in terms of services around the patient. And most healthcare professionals appreciate these messages that have valuable content and may be more responsive when it appears more personalized rather than, say, a mass-generated email from a company related to the times that we're living in right now. Messages obviously still need to contain only approved content, both from a promotional point of view and a scientific exchange point of view. However, they could be distributed to healthcare professionals through things like CRM software that has sales rep triggered email capabilities and capabilities to attach documents like a PI, should that be one of the mechanisms you determine is appropriate to ensure fair balance. So again, kind of thinking about the framework that I described a little bit earlier, and these key elements and considerations to field force activities should help the internal discussions around how the business is going to continue to fulfill its duties and how compliance is going to continue to, again, detect, correct, and most importantly, prevent problems as it relates to messaging and off-label promotion. So with that, I'll hand over to Mark, who will wrap up the discussion. And again, hopefully this has been helpful to everyone to at least spark a couple of ideas and thoughts based on what we've heard from clients as well.
Perfect, thanks, Saul. So there's going to be a lot of challenges in this new world that we're living in, and we've listed several areas of focus here and different challenges associated with that. One of the things that I would highly recommend to this group is that, and I've always said that if it isn't documented, it didn't happen. Then how can you prove your own compliance with that? I always use the phrase trust but verify. So making sure that you do have that appropriate documentation in place. And how do you go about doing that? One important thing, as we noted in one of the first slides, is privacy. The world of privacy has changed dramatically in the last several years, and really it continues to evolve. It's not just a European GDPR issue. California has its own law now, and making sure that people are on board knowing what if they are being recorded. So just at the beginning of this conversation, we made note that this is being recorded and will be shared with the group, but that's the world that we live in nowadays, is that privacy has become such a huge issue. What is going to be a huge challenge is getting an active audience. As Saul indicated, our healthcare providers right now are just overloaded, and they're trying to help patients to get through this mess. So as you're being respectful and trying to make sure that they have time to see their patients, but at the same time making sure that you're being respectful of their time, so not trying to schedule 30 minutes for a call or something. So as you get to that, and you do have something scheduled, let's say, is getting to the point. Another big challenge I know a lot of people are talking about is meals. So for instance, with speaker programs, do you even provide them anymore? I know several companies have asked, well, should we maybe potentially use, let's say, Uber Eats and offer a meal or something alongside of that? But you really need to challenge some of those different types of mechanisms, because you're doing this in a completely different type of format. So if we could move to the next slide, and we'll wrap up here, and we're trying to keep this to just the 30 minutes, maybe finish a little early even, but I encourage Saul and Awet to jump in here. As we're just talking about general reminders here, is that we understand that there's access barriers. We are in a crisis here, and this is a global pandemic. It's not just a US issue, it's all over the world, and we're all facing this together. So you need to also look at what those expectations are that you're putting on your field reps. Are they going to even be able to make the same amount of calls every single day? Because now they have to be scheduled. Likely not. So really looking at a new paradigm and how reps, commercial and medical, can go out and to make sure that they're seeing their physicians and HCPs and getting their message out, but putting realistic expectations on them. We're all going to have to adapt to this new way of working. So as I said before, when you do have an active audience, be genuine. Make sure you're giving that fair balance, but also be short and concise to that matter, which is, again, why we only wanted to do this for 30 minutes today, because we all have a lot on our plate, and being respectful of that time. This is a huge abrupt change to the business, and change isn't something that's easily taken by a lot of different people. A lot of HCPs are very set in their ways and how they go about managing their own business, seeing their reps, but also treating their patients. And so they're in a whole new environment on how to go about this. And it's something that, we all have to deal with. So I'll ask Saul or Wet if they have anything else to add in here from just a general reminder perspective.
I think the fourth bullet point on the slide is important again, and speaks to, again, the framework, and it's relevant in the normal world, and I think even more so here, where perhaps the interaction is not as obvious sometimes, and that's really understanding our responsibilities from a role in the field, and then making sure that that's communicated to the healthcare professional that's being engaged with, and what is the objective of the call, what is the objective of the interaction. and then what are the limitations of what one can do in the context of that role. I think that remains a very important piece, perhaps heightened in the context of the nature of communication going forward. That's probably the one that I would add in. Wade, I'll hand over to you.
Yeah, and I think in line with, again, having realistic expectations, obviously your customers are most important, and you want to make sure that you're not adding unnecessary burden in order to communicate with them. At the same time, realize that all the other organizations are probably going to go around the same route. So reps may not have the same amount of access time, usually being early in the morning or in the evening. Some things that I have heard in the field that come from this is the expectations now for the reps as far as goal setting, goal attainment. These are where you're going to start to see maybe more concern around non-compliant behavior, because they're going to try to do everything they can to make sure they also maintain their goals. But I think in general, making the process easy, limiting any opportunity for reps to have discussions that's not using approved material, again, being short, concise, to the point, providing the information the HCPs need, but then again, making sure the reps are not going off track to make it also convenient for them. It's a learning process for all of us, and I think the more information we also take in from the field as far as what they've been hearing from their HCPs, what may be working for them, will also be beneficial. I think what we'll see now is HCPs who are slow adopters early on, for example, electronic medical records, things like that. Now we see them going toward telemedicine. I think they'll be open to this, so I think if we make it easier for them, this transition will eventually be smoother in the long run, but these are some things to keep in mind initially as everybody else is also thinking about how they're going to do their monitoring moving forward. So hopefully this was helpful.
And I think,
thanks,
sorry, Mark, I'd just add one more thing in terms of new processes, et cetera. You know, as we look at the OIG's focus on things like speaker programs and lunch and learns, speaker programs and lunch and learns are not happening right now in its traditional form. There is a real opportunity in the industry to establish a foundation for new processes going forward. And this shift to virtual may be just what the industry needs to set up something different. Speaker programs are a critical component of conveying product information to physicians that may not, for example, be able to see sales reps in their day-to-day work environment. Lunch and learns are a way of educating the office around the use of products, etc. These are critical components of the promotional continuum and share of voice, but are also under threat in the context of enforcement. But we really have an opportunity. While there's a big challenge going on right now in the market from the point of view of COVID-19 and the impacts on our interactions, there's a real opportunity to become a standout in how we operationalize around virtual interactions while remaining compliant. So while there is a lot of pressure on our organizations, our sales reps, and our healthcare professionals, there's also a great opportunity in front of us. And so, again, hopefully some of these thoughts and frameworks are helpful to some of the internal discussions that all of you are having. So hand over to Mark to close us out, and thanks for everybody's time.
Thanks, Awet. Thanks, Saul. And as we wrap up here, I just want to thank everyone for their time today, and hope everyone is staying safe and figuring out this is hopefully not an extended new norm, but during this period of time, it's hopefully will spur innovation and efficiency in our respective jobs and how we go about it. Because I think from this point forward, things are going to change. And if we really leverage technology, just like we are here, to be able to make us more efficient in our daily activities and jobs, I think it is going to spur innovation. So again, with that, we're just at the 30-minute mark here. I really appreciate everyone for dialing in. We will circulate this slide deck, and there's some additional slides after this as well for you all to review. But if you have also given questions, we will do our best to make sure to answer those questions to our best of our ability and circulate that as well. And also the actual conference itself will distribute. So thank you, everyone. Appreciate it, and stay safe. Thank you.
Thank you for joining today's call. Again, as a reminder, today's call was recorded. Please be on the lookout for a link to the recording in your inbox. You may now disconnect.